Hello and welcome to Healthcare Leadership in Action, a podcast from the Faculty of Medical Leadership and Management. This podcast is about equipping you with the knowledge and skills you need to become a better leader in your health system. My name is Jamie Smyth, and I'm a junior doctor and FMLM's own Douglas Fellow. Join us as we discover what it takes to put healthcare leadership in action. So the last few years have seen health systems around the world come under unprecedented strain and scrutiny, with healthcare staff consequently asked to deliver higher quality care, often with a dwindling workforce. It's not surprising then that globally, healthcare workers are reporting high levels of burnout and fatigue. On today's episode of Healthcare Leadership in Action, we'll be discussing compassionate leadership, and I'm very excited to be joined today by our two guests who have made compassionate leadership integral parts of their careers in different ways. I'm joined by Dr. Renee McCulloch, a Pediatric Palliative Medicine Consultant and Great Ormond Street Hospitals for Children's Associate Medical Director for Workforce. Renee has a wealth of experience in delivering palliative care for children across specialist hospitals, hospices, and in the community. Furthermore, during her time spent in Kuwait, Renee was instrumental in establishing the first children's palliative care service in the Middle East. I'm also joined by Professor Michael West, Professor of Work and Organisational Psychology at Lancaster University. Michael's contributions to the study of teamwork and leadership has been nothing short of prolific, having contributed to over 20 books and over 200 articles on the subjects. He has also used this experience to improve staff well-being through the development of national leadership development frameworks and leading reviews and inquiries into the well-being of doctors and nurses. So thank you both for your time and for coming on the show. We're really pleased to have you here today, and I'm sure our listeners are really excited to hear all that you've got to say regarding compassionate leadership and leadership in general.
Thanks, Jamie. Nice to be here.
Pleasure to be here.
So compassionate leadership is something that's started to come up in a few different terms over the last few years, when really medical leadership has been getting a bit more attention academically and practically. But I think for a lot of people, compassionate leadership, people won't really know what the difference is between regular leadership and compassionate leadership. So for Michael, what is compassionate leadership to begin with?
Well, I think it's important to understand what we mean by compassion, first of all. And Paul Gilbert, the guru of compassion, defines it as a sensitivity to suffering in self and others with a commitment to prevent or alleviate it. And I think in practice, what that means is 4 fundamental behaviors. So, for example, if you were in pain or distress, Jamie, then for me to be compassionate, I have to attend, understand, empathize, and help. And attending means being present with you here and now and giving you my attention. Nancy Klein talks about listening with fascination. And second, I have to seek to understand through a dialogue with you the causes of your pain or distress. That in turn enables me to empathize with you, to feel your pain without making it my drama. And that gives me the motivation then to help you or serve you in some way. And so compassionate leadership is simply the application of those 4 behaviors in the context of leadership, being present with those we lead, having the courage to be present with those we lead and listen with fascination. We've only got 60% of the staff we need on this ward to deliver safe care, to seek to understand the challenges that staff face through having a dialogue with them rather than imposing an understanding from some elevated remote hierarchical position, and then empathizing with staff, feeling what it's like to be a foundation doctor on your third 13-hour night shift in a row, not having had time to take your rest break, feeling really anxious that you're working in a situation beyond your competence, and then helping those we lead. And in the context of leadership, that means helping those we lead to do their jobs more effectively by helping to remove the obstacles that get in the way, and by helping to ensure that they have the resources they need, the right numbers of staff, the right equipment that works, and the right training.
Can definitely empathise with some of those issues between the junior doctor aspect in terms of being on the longer shifts. And what drew you to this field of compassionate leadership in the first place? How did you first get interested into it? It's something you've published quite a lot on.
Well, one always constructs a journey in retrospect as having some kind of thought through process. I had always had a huge interest in the contemplative traditions. I did a PhD on the psychology of meditation back in the 1970s, but from particularly the 1980s onwards, my work focused more and more on healthcare organizations and cultures, and more on leadership. And the more that I studied and undertook research, the more I understood that the basic behaviors of effective leadership from studies on leadership over the last 60 years indicated that what was really important for leadership was being present and listening, seeking to understand the challenges of staff, having emotional intelligence to empathize with staff, and that the role of leaders is to help people do their jobs more effectively, the principal task. And there was, I think, a rather, for me, a watershed publication in the Academy of Management Journal about 15 years ago now, Academy of Management Review, a special issue on compassion in organizations that brought together a lot of leadership research. And I suppose in my life, the two streams of the work I'd been doing on meditation and contemplative traditions and philosophy coalesced with this work on leadership in organizations. And it just became really clear to me that because compassion is so fundamental in human behavior, and the behaviors that constitute compassion turn out not coincidentally to be the same behaviors that constitute effective leadership, it was just a very clear signal that this was the direction we should be going, and particularly in healthcare, which is fundamentally about compassion towards those we provide care for. So it was that confluence of streams, if you like, into an understanding that compassion and compassionate cultures and leadership is the wisdom and the practice that we need in our healthcare systems.
I'm really interested how you made the kind of connection between, doing a PhD in meditative practices towards healthcare. Was that again a kind of reflection on compassion back then as well? And like you say, this journey's kind of just been pieced together in retrospect. Was there even back then some kind of reflection towards compassion through and peace through meditation that brought you towards healthcare? Or how did you make that transition?
I think it was certainly not an intentional transition. I joined the Medical Research Council Social and Applied Psychology Unit in Sheffield in 1984, and I was doing research with a colleague, Nigel Nicholson, who is now at London Business School, into work role transitions and how they lead they lead both to innovation in the jobs that we move into, but also to personal growth. And the first study I was involved in was a study of nursing students, people who are very bright, highly motivated, placed in a position where they have almost no discretion or autonomy. And of course, what we see is very little personal growth and a lot of frustration. About 37% of them left nursing training. And then we looked at another group, health visitors, who had lots of autonomy in their roles, and there was lots of satisfaction and personal growth. And then I started to look at the teams that they worked in as being key to the contexts of their well-being, their growth and development, and their innovation in the way that they provided care. And so, in a way, it was the coincidence of working on a theoretical issue that led to practically working in healthcare, and from there my research interests and career unfolded in a way that's just been hugely privileged for me. The opportunity to work with people working in healthcare over the last 40 years for me has just been an amazing blessing.
Yeah, I love hearing stories about hearing how people have come into healthcare from non-traditional routes. And this fellowship this year has really given me an opportunity to speak to people who I wouldn't normally have been able to come into contact with in different parts of the health system, and really take a step back from clinical care and see that the health system is more than just people on the front line. It's people who are informing the research behind our leadership, the research behind our clinical practice, and not just, delivering the care, but shaping exactly how clinicians deliver that care, which has such an impact on patients that I think sometimes we as clinicians on the front line often forget that there's so much more that goes into healthcare than just the delivery of healthcare itself. And when it comes to compassionate leadership specifically, why do you think that's so important within the NHS, especially at the moment? And what does it offer that other leadership models don't?
Well, in the first place, I would say that what's important to understand is that compassionate leadership, in one sense, is not a new model of leadership. It's those four behaviours, but also to recognise that compassion is part of who we are as human beings. It's one of our, Paul Gilbert describes it as one of the three core emotional regulation systems that we have. There's a threat-based system, there's a goal acquisition system, and then there's a nurturing compassion system. And so it is fundamentally part of who we are as human beings. And when we're compassionate, we create more psychological safety in our relationships. When we create compassionate cultures, we create safer environments so that people are more able to thrive, to develop new and improved ways of doing things. But, more prosaically in a way, I think what's important to understand is we've got data now from 20 years of the National Staff Survey in the NHS in England. That's over 600,000 people responding every year to that survey. 20 years of data shows us that the more people in an NHS trust to report that their leaders attend, understand, empathise and help, in those organisations subsequently what we see is higher levels of staff engagement and satisfaction, higher levels of patient satisfaction, better care quality, better use of resources, and in the acute sector, lower levels of avoidable patient mortality. And so, all of the evidence tells us that these are the leadership behaviours that are fundamental to delivering the outcomes we seek. And I think it's particularly important in the current context that you described in the beginning. We've been seeing staff stress levels rise in the NHS for at least the last 8 to 10 years. So much so now that nearly 1 in 2 staff report that they've been unwell as a result of work stress in the previous year. And over a third report being burned out at work, either often or all of the time. So it's vital that we create cultures where we're able to ensure the well-being of staff and that we retain them, because the consequence of these high levels of stress is less safe patient care, our inability to retain the staff we need to deliver care, and high levels of sickness absence, all of which just add more strain and difficulty within our healthcare services.
And Renee, so how do the 4 behaviours that Michael has brought up regarding compassionate leadership, how does that translate into your world of palliative medicine in paediatric medicine?
It's really interesting, Jamie, because palliative care is obviously all about the relief of suffering. And as Michael said, compassion just means being in suffering with another and trying to prevent and alleviate that suffering, which is core principle really to palliative care delivery. And that's not just about relieving symptoms, which is often the default kind of thought about palliative care. It's really about working alongside patients and families with regard to the multiple losses they experience, their sense of self, for children, loss of kind of growing up, loss of all the hopes that their parents would have had for them, and understanding that and being alongside parents and other family members is really important in element of palliative care, which is fundamentally sharing that space that they have not chosen to be in. So in order to really understand that space and in order to be, as helpful as possible, you start your work with gaining trust, and you do that through being fully present in the moment when you're with families and patients, really listening to understand what their issues are. And that's the attending element of compassionate leadership. It's actually just that, really active listening that we do to really start to notice what's going on in that space for the patient and their family, really kind of observing what's happening, what those dynamics are, listening to the language people use, picking up on cues. And then the next part of, that gentle inquiry, is really finding out, who they are, what this impact on them is. Absolutely not bringing your agenda onto the table at that point, but actually that's all about really finding focus in that here and now, finding out about the complexity that those families, patients are sitting in. And really, the caring is important in terms of empathy, that all through, I mean, there's no order to this. Empathy just has a thread right the way through everything you do really in palliative care, because, obviously the clue is in the name. It's all about the care that we offer and hopefully deliver to patients and families. But the important element, I think, is really understanding the space they're sitting in, the complexity that they're in, and then exploring that really with open questions and an open mind, understanding what's influencing their decision making, where they are in terms of, their own understanding, their own choices, really working in partnership. And that's often, the really important element, again, of being helpful is working in partnership, because it's very multi-layered. And, a lot of the approach is really understanding the position and then starting to think, well, how can I help? What blocks can we remove in, where we're at here? Often myth busting about maybe drugs and perhaps, fears, preconceptions, maybe, offering some reassurance. So that really good approach to individualized, attentive patient care is something that is very kind of fundamental to palliative care, really. It's the core of what we do.
So obviously pediatric care in general is quite, an emotive situation, an emotive scenario. I mean, looking after unwell children. And how does that translate beyond your role within palliative medicine specifically as well, but as your role as a workforce lead within Great Ormond Street? How does that compassionate leadership influence that role and the work that you do in leading the workforce?
Well, as Michael alluded to, I think workforce is one of the, biggest problems that we have in the NHS. There are it's a complex milieu of issues, of people feeling there isn't enough resource, burnout, stress, particularly the last few years, COVID, industrial action. It's been a really difficult place to be in. And in all honesty, I think it's really interesting because I hadn't really realised how well my clinical work had prepared me for being a compassionate leader, actually. And I think kind of those 25 odd years of working in paediatric palliative medicine, it felt, although it feels intuitive and instinctive, I do feel that as leaders, one needs to learn how to communicate well, and one needs to be able to really draw on those skills of very active listening to really understand what's going on in the system and understanding that complexity. And that has to be at grassroots level. You don't have to be down in the detail all the time, but you really need to understand what it feels like for people. And again, that's the element of kind of alignment and empathy that comes into just actually knowing what that lived experience is like in the moment for people when, they are feeling overwhelmed or there's an issue that's going on. It's really important to be present alongside people, I think. And I think now the elements of compassionate leadership that, you bring to workforce, when it, as a leader, it can feel overwhelming, all the problems that you face. But it's just actually acknowledging that and acknowledging your own vulnerability in that too is also part of being compassionate. I think, an example, I suppose, during COVID, we moved our whole medical workforce onto different rotas. to anticipate that we were going to have, 30 to 40% deficit in our workforce. And we redistributed all the work equitably across the workforce, across our doctors. And we put in this backup system of, if somebody was going to be off sick, we had somebody available who knew they were on backup. And I think that just showed everybody that we cared about them, that we knew that we were all in a vulnerable situation. We didn't know what was going to happen, but we had their backs, and we wanted them to know that we wanted them to be rested. And for those 4 months right at the start of the pandemic at Gosh, we didn't need to draw on any locum work at all because we had it. We reorganized ourselves. Now, it wasn't perfect. There were problems with that, but we acknowledged them as we went along. So I think it's about stepping into it, and in some aspects kind of being brave. Again, something to do with perhaps being in palliative care, but you're often in a situation of challenge and difficulty and not knowing. And that translates quite well into workforce dynamics, just sitting with that and coming alongside and trying to figure out perhaps small changes that will make a difference.
Yeah, I can relate to that what you described regarding those shadow rotas regarding COVID. I worked on something similar during my internal medical training whenever COVID happened. And I think that reorganization of workforce and efforts really did help to make you feel more supported and more encouraged. Like, generally felt like everyone was in this together. Like, even seeing consultants coming on and doing night shifts and doing more weekends as well, that senior presence and that visible leadership really did help to fuel that feeling of camaraderie, and really helped confront the unknown, which I'm sure in pediatric care the unknown as well is something that hangs over you as well, especially within palliative medicine as well.
And Jamie, if I can build on what Renee was saying, I think that for me there's something really important in there about leaders, not necessarily knowing. One of the issues that I'm aware of increasingly is the moral distress of leaders. We talk a lot about the moral distress of frontline staff not being able to deliver the quality of care they want to deliver. I talk to lots of leaders now who recognize that probably the biggest challenge that we face is chronic excessive workload for our healthcare staff, and leaders feeling really reluctant to talk about workload with staff because they don't know what to do, and feeling distressed as leaders because they feel they're not dealing with that most difficult challenge that we face of chronic excessive workload. But I always say it's not the role of leaders necessarily to have solutions to problems, but it is their role to bring attention to bear on the most difficult issues we face. And the importance of self-compassion as the fundamental element of our own compassionate leadership, I think is it's just vital we understand that in order to be present with others and to understand others, it's important that we, as leaders and as clinicians, practice being present with ourselves, so that I'm aware of when I'm feeling overwhelmed, angry, irritable, ashamed, inadequate, and that we have the courage to accept those feelings in order that we can then inquire into them. Why am I feeling like this? Yeah, I've not had a rest break, or I just had a difficult interaction, and that we then bring a nurturing attitude towards ourselves, just as we would be caring towards somebody else who was overwhelmed or upset or feeling really wounded as a result of a difficult conversation. We can bring that nurturing, caring attitude towards ourselves by asking questions like, what am I feeling right now? What do I need? How can I get those needs met? And what we know from a wealth of research evidence now is that when leaders are self-compassionate, in not just as a kind of leadership skill, but as a way of being, that they are able to connect more deeply and authentically with themselves, and thereby connect more deeply and authentically and courageously with those they provide care for, those they lead, and all of those that they interact with. And what the research evidence tells us is that self-compassion amongst leaders is associated with their staff being even more compassionate to those they provide care for, and also learning to be self-compassionate, which is at the basis of our ability to be compassionate towards others.
I think that's a really interesting point, Michael, because I reflect on my own career and working in a really intense, challenging area, which there are in so many areas of healthcare. But realizing very early on that in order for me to have any kind of longevity of being in this space of distress and grief, often alongside other people, I had to really understand what that felt like for me and the impact of that on my life and who I am. And I worked quite hard on that early on when I had, going through my training and having young children. And I set up my own kind of clinical supervision. And I started to recognize patterns of when I felt really heavy, when I used to describe it as having a lot of rocks in my backpack, and my backpack getting so heavy, it slowed you down and you felt like you were walking up a hill with, a 10-ton stone in your back. And starting to recognize and feel that, and know that when that happened, I needed, my own intervention. And actually then, as my career's gone on, understanding that actually, as you say, being in touch with your own feelings when you're in that difficult situation or you're feeling really challenged, there's a reason why you're feeling, perhaps slightly nauseous or anxious, or because it's hard and it's really hard work. And actually being kind to yourself and knowing, okay, well, this is really tough, and this is why I'm feeling like that. I'm going to go and, have a coffee and sit on a bench, or just, allow myself to feel where I'm at before I can move into the next piece of my work. And I think that connecting to yourself is really, really important. And that's where we start. And we have to be honest about that vulnerability, about leadership, because I think that goes hand in hand, actually.
And it is interesting because I think, there's almost a double bind. As a healthcare professional, I have the orientation, I'm here to care for others, not for myself. And as a leader, we have the orientation that I'm supposed to be competent and capable and here for others, not for myself. But in fact, in both those instances, what the research evidence increasingly tells us is that caring for ourselves, doing what we need to do in order to enable ourselves to be well, to be happy, to be healthy, to be full of hope, is fundamental to our ability both to provide compassionate care for others and to also lead effectively. And as you say, that can be something as simple as taking a break and sitting outside on a bench near some trees and flowers. I'm fascinated by the research on spending time in nature, which shows, this kind of hierarchy of natural spaces that help our recovery, with blue spaces the most powerful, and then green spaces. Blue spaces, lakes, rivers, the ocean. Green spaces, the woods, the forest. But urban green spaces are very powerful for recovery as well. And the rather mysterious and beautiful finding that the more biodiverse the space we're in, the more trees, plants, flowers, birds, animals, butterflies, the more we recover. And so putting into practice what we know about how to take care of our own well-being, I think, is core to self-compassion, and of course core to compassionate leadership and compassionate healthcare.
That's right. And we have to start to run that thread of permission. I think a lot of this is about permission to people. Actually, we don't want you to overwork. We want you to be working, at a pace that you can take. We want you to be able to say, this is too much, it's too hard. We don't want people to sacrifice themselves in this system. We need them. We need them to keep going. And I think part of that is the permission to be able to speak up and be able to, have that autonomy as well, to have their own agency in that.
And it's lovely to see some of the training now. Foundation doctors in the northwest are being trained and developed in compassionate leadership, as are their trainers and their administrators. And in Berkshire Health, they've been retraining all of their staff in compassionate leadership for the last 5 years, and they now have the lowest levels of staff stress and the highest levels of engagement of any mental health learning disability trust in the country. Wales has a 10-year strategy to develop compassionate leadership across the whole of health and social care. And there are many such examples, which I think are really encouraging. I know in Ireland, the Royal College of Surgeons of Ireland now has compassionate leadership as part of all of their undergraduate and postgraduate medical and nursing training. And those examples, I think, are important models for all our healthcare institutions, and they provide hope.
As we're discussing this and the strengths of compassionate leadership, I'm aware that some listeners might be listening and thinking, well, this sounds fantastic, but the reality of my clinical life is that I'm run off my feet. I don't have time for breaks to go to the bathroom or eat lunch, let alone go to the staff garden. And some people might be thinking, the compassionate leadership might make it difficult to have, difficult conversations or confront underperformance within a team. Do you think that these are, real weaknesses of compassionate leadership, or do you think that these are misconceptions that actually, if anything, compassionate leadership may help you to reframe these discussions in a way that people are more able to speak up, like Renee says, and be able to ask for that help?
Yeah, I mean, in the first place, in relation to compassion taking more time, the research evidence is that compassion doesn't necessarily take any more time. It's less about doing something additional in our interactions, for example, with patients, and more about just increasing the extent to which we attend, understand, empathize, and intend to help. And compassion is not some soft cushion scented candles approach to leadership. Far from it. I think it requires a lot more courage and authenticity to lead compassionately than what can be a rather easy opt-out of top-down command and control leadership. I just tell people what to do and then they're expected to do it. Because our compassion is ultimately for the patients, the service users, the communities we serve, and the staff that we lead. So it's about having a really strong focus on being effective and making sure that we are courageous enough to have the difficult conversations when there are problems. And compassion really, those behaviors help us to have those difficult conversations, because in the first place, it's about listening and understanding why there are problems of performance, or people are behaving aggressively in their roles or in discriminatory ways. So seeking to understand, first of all, and giving people really clear feedback. That's what compassion is about, giving people, I've seen examples of bad behavior in healthcare where the problem has been that no one has ever given the individual any feedback. And so, they're astonished when they receive feedback. And then it's about, I think, coaching people and setting goals. But it's ultimately also, if a person's behavior, which is, let's say, aggressive in the context of their team, doesn't change, we know that for frontline teams, for teams delivering clinical care, that presents a threat to safe patient care. And so ultimately, we have to compassionately, but clearly and courageously, manage those people out of our frontline teams.
Yeah, I completely agree with Michael. I think it's a misconception that compassionate leadership fails to manage challenging behaviour. Good leadership is about fairness, honesty, transparency, understanding those boundaries, and creating that boundary with, and for the organisation. We have a responsibility to do that. Knowing that humanity involves people crossing boundaries sometimes, we know that we have to understand when that's not okay, and when we see those poor behaviours emerging from often really good people, we need to ask why that is, and really think about our organisation responsibility as well, what we ask of people. But I think as Michael said, unless we really notice, we miss an opportunity for those early interventions that could actually then pivot somebody's career to head in the right direction. And perhaps they've got a blind spot about how they come over or how they're behaving. And I think that kind of that's the helpful element of the compassionate leadership, is actually trying to help redirect and trying to help people understand how they come over, what that looks like. And if necessary, moving into, the next level. But I think that is fundamentally what powerful leadership is about, perhaps sitting compassionate care hand in glove next to your, authority, that they have to come together and sit together.
And do you think there are situations within healthcare where compassionate leadership is not, the most appropriate approach? Or do you think it's something that we should be, striving for at all times in every scenario in order to advance every aspect of healthcare?
So, yeah, I mean, the primary purpose of compassionate leadership is to develop sound culture, and leadership shapes culture. And, as I said, kind of fundamentally, I think, compassion, leadership, holding authority in a compassionate way are really powerful. And that demonstrates this, very sound culture to those, working in health and social care. And we have to keep striving for that, I think.
I agree. I think, compassion is about connection. It's about caring connection with each other. And the challenges that we face in healthcare really require that we work in an interconnected way in our teams, in our hospitals, with social care, with primary care, with the voluntary sector, with local council, with families, with communities. And, more widely, the challenges we face as human beings, I think, require a recognition of our interconnection with each other around the world and with the ecosystem of which we're a part and with the planet which we've done such damage to. So, as you say, Renee, I think nurturing compassionate cultures through compassionate leadership is fundamental to our ability to deliver high quality care for our people in our communities, but it's also fundamental to our ability, I think, to respond to the challenges we currently face in our evolution as a species. So I can think of no situations where compassionate leadership would not be the appropriate orientation and response.
Yes, me too. I'm trying to think of a situation and I actually cannot, because I think it's about living with that approach. I can't think of any time when you don't want to wait and listen and understand and care and help.
Yeah, so compassion and compassionate leadership is less about a model of leadership and more about a way of being.
Yeah, I was about to ask that actually, in light of everything the two of you have said, both just now and through the conversation so far. Would you agree that maybe compassionate leadership is less of a leadership style? We often talk about leadership styles within the field of leadership and management. Would you say it's less of a style than it is actually more of a foundation off of which we should be building other styles and approaches in order to influence culture and embed a culture of compassionate practice within everything that we do?
Yeah,
absolutely.
So compassion, what's also important to understand is that, this is not some learned behavior. It's part of who we are. And our challenge, I think, is to correct the imbalance between our emotional regulation systems focused on threat and focused on goal acquisition with our nurturing system, which is about compassion. And, what's really fascinating about, neuroscience studies show us that the difference between empathy and compassion is when you ask people to be empathic to somebody in pain or distress, that's associated with the activation of pain centers in the brain. But when you ask people to be compassionate with that intention to help, that's associated with the activation of reward centers in the brain. Because, you know, evolution has shaped us to have this response. It's what's enabled us to form social groups, tribes, communities, families. And it also benefits us. So, for example, in randomized controlled trials with GPs and with nurses who are asked to be, or briefed to be, extra compassionate in their interactions with patients over a 2-week period, that has a significant impact on their own mental health. You see lower levels of anxiety, stress, and depression as a consequence of that. So I think it's very much about recognizing this is about a way of being as a human being, as a way of living more happily, more successfully, and connecting more deeply and authentically, not only with those that we lead and work with, but in fact with all of those we interact with in our lives.
Something I'd like to add to what Michael said, I do think that some of the listening and communication skills do need to be learned, and it's really useful for people to start to kind of understand, you know, find their own approaches, use different language tips and tools, because it's not necessarily intuitive to some people. And, you know, just reflecting on, again, on my own career, one of the most useful things I did as a consultant was a mediation course, actually. And that really was very interesting about, again, you know, sitting in that area of difficulty and how do we help people to move out of their positions if they're very entrenched and very stuck, and what can we do? So I think there are ways to help develop people professionally to be able to be, you know, better at some elements of compassionate leadership. But I agree, it's just a way of being. It's the starting point.
No, I absolutely agree, Renee. One of the depressing findings from research is that in 17 out of 18 studies of medical students in training, compassion declines. And that's a real indictment, I think, of some of our medical training. And we do know from research on developing compassion in people, training people in compassion, that it's eminently achievable, that we can help people to learn to be present with each other, to listen deeply, to use reflective listening, to develop their skills of emotional intelligence. And I think the only caveats are that people, A, have to want to become more compassionate, and B, believe that they can. But aside from those caveats, the research, I think, is incredibly hopeful and inspiring in telling us that we can really strengthen people's ability to both be compassionate and lead compassionately.
So compassionate leadership, attending, understanding, empathizing, and helping, not just a leadership style, but a way of being. I have one final question for you both. And, you know, we want this podcast to be about action and bringing about practicable leadership change and development for our listeners. So what could our listeners begin to implement this week within their own practice to help embed a culture of compassionate leadership within their workplace, teams, and organizations?
So for me, that starts with self, actually. Just for them to start to think about themselves and who they are, and start to notice their feelings, start to know when things feel difficult, and start to consider how they are and where their energy is, what gives them energy. I think that's probably, for me, the most important place for our leaders to start, and then to be then to be just trying to have that kind of attentive, fascinated listening experience to someone else, and start to practice that. To start to notice who you are, how you listen, and, you know, the extra information you get when you perhaps don't speak.
Yeah, so I would also say it's about being present, and we can, as you say, Renee, we can practice being present in every interaction, and understand that it's not about trying to be present. If we make this just another task, oh, I've got to be present, I'm not being good at being present, we're adding another layer of difficulty. I think being present is about letting go of, you know, my worries, my concerns, what I'm thinking about, the immediate pressures, and just being with the other person. And that's a relaxed, it's a letting go process, I think. And just being present in the here and now, which then enables me to listen with fascination. And that being present, I think, in that letting go way, also applies to our ability to be present with ourselves, to let go in the moment and to experience myself in this moment and what I'm feeling, so that I become more aware when I'm feeling busy, pressured, anxious, and then to be able to bring a nurturing attitude. So practicing this letting go, to simply be present in our interactions with others and with ourselves, I think is, for me, a fundamental starting point for all of this.
Really good tips. I think, yeah, being present, especially in healthcare, when you've got noises going on, competing demands and everything else, is a really difficult thing to achieve, but definitely something that's worth putting the effort into making that happen. And yeah, starting with self, definitely. You can't lead other people, you can't lead patients unless you can develop that understanding of where you are yourself. I mean, the FMLM leadership standard starts with self-leadership before you kind of building in team, organizational and system leadership domains as well. So that's absolutely vital. So thank you so much, both of you, for joining us on the show this week. It's been incredible to speak to you both and hear both about your journeys and how compassionate leadership has shaped the careers that you've had so far. Speaking to people like you gives me real kind of optimism that, the healthcare systems we work in might be struggling, might have ongoing, issues and teething problems, but with people like yourself championing things like compassionate leadership, I think, that gives me a real sense of optimism for going forward.
Thank you, Jamie. It's been a privilege to speak with you and also with you, Renee. Thank you very much.
Oh, thank you, Michael and Jamie. Yeah, pleasure.
Thanks for joining us today on Healthcare Leadership in Action. Remember to subscribe wherever you get your podcast from. And if you want to learn more about what we're doing at the Faculty of Medical Leadership and Management, sign up for our newsletter at fmlm.ac.uk/sign up. Thanks for listening. We'll see you next time on Healthcare Leadership in Action.